Okay, let's move on. And Dr. Cole, wanted to ask you about this. We got a great guest on the line, but before we introduce him, I want to ask if you've ever had a full mobility assessment.
I have, Steve. And when I started to train for climbing, I really had no baseline metrics or measures. And we actually do the same thing for in basketball and other sports. There's been a couple of variants of this, sort of what we call a functional movement screen that has basic movements, but I am not really familiar with one that's been sports specific, but per se. But there's a number of simple things that can be done to say, hey, this is where you are, and then when you engage in a program, and that's why these things are good, because they can actually get you a baseline, and then you can see how you progress over time. Or if you have injury, you can always compare back to the baseline to say this is where I was, or this is where I was when I was improved, and to have some goals to sort of strive for based upon these metrics. So it's a really interesting area for sure.
Well, yeah, I think it is, and I want to bring on Eric Ridings right now, our next guest. He is a strength and conditioning coach and a TPI, Certified Power Coach, TPI standing for Titleist Performance Institute, of course related to golf and the Titleist brand. We're going to review methods that Eric uses, all of which promote better movement, what some people like to call prehab or injury prevention. Eric Ridings is from Mobility Works Chicago. Eric, how are you this morning?
I'm good. Thank you so much for having me on.
Well, talk about some of the things you do when someone goes through a full mobility assessment. What does that mean? Dr. Cole touched on it on his end, but this is really can be specific for athletes and what I like to call the weekend warrior out there, correct?
Definitely. And Dr. Cole, you really started to hit it on the head there as far as the ability to identify any sort of physical limitations, but it's also really great at creating a roadmap. So it can tell you where you can train somebody hard and challenge them, and it can also show you the areas where they need to improve on. And then it's a reassessment tool as well, so you can take a step back in a few months, look at where you've progressed, see if the program's working, make adjustments if necessary, and it continues to build on itself to help develop an athlete into their full potential, as well as drastically reduce the risk of injury.
Eric, it's interesting. I wasn't necessarily aware that these were sort of sports specific. So I know you're at the Titleist Performance Institute, and I'm just curious, and obviously that's golf. So are these different movement screens generally sports specific, and do you have one that's actually specific to golf?
Yeah, so Titleist has put together a 16-move assessment that breaks the body down, similar to the FMS, but that's kind of general human movement, where this one's golf specific. So it really looks at some of the prerequisites that are necessary for a consistent, powerful swing. And it allows us to, again, highlight the areas of need. So whether that's thoracic rotation or shoulder mobility or hip mobility or even down to the wrist, it, again, allows us to create a hierarchy of what's most important to least important. And that really, really helps the strength professional put together a great program for that client.
Eric, what are some of the most consistent limitations that you see with your athletes and clients?
Well, if they're athletes, they tend to be a little bit unstable, where they tend to be very athletic, but they don't create a good amount of force at end ranges, which when you're swinging a club, for instance, as violently as they are, it can set them up for a bit of injury just because, like I said, they're just unstable at those last little bits of range of motion. But a majority of them are initial posture positions. So a lot of my clients come out of an office, essentially, and so they've got some of these stereotypical postural issues, whether it's rounded shoulders or an anterior pelvic tilt. All these things kind of set you up for a bad base, in a sense. So a lot of the times what we do is assess their static posture first to try to address their initial positioning, and then we try to see if they can move a little bit better, just purely off of kind of balancing the body left to right, front to back, and rotationally.
Again, we're visiting with Eric Ridings from Mobility Works Chicago, talking about the importance of getting a full mobility assessment. He's a movement specialist. Dr. Cole?
No, Steve, have you actually done this? And I'm curious, what's it like? Was it challenging? Was it revealing to you to see where your limitations were and so forth?
Absolutely, and I know it's been well documented on our show here, Sports Medicine Weekly, Dr. Cole, that you performed shoulder surgery, the tenodesis, the tendon surgery on my right shoulder, almost 2 years now. And yeah, my mobility has not been great. Still trying to pitch batting practice, and my golf has been a little limited, but not bad. But no, I went through the movement assessment and mobility assessment with Eric, and I was fascinated by it. I knew of some of my deficiencies, but he's done some massage therapy, and it's just been great to see where my limitations are. And then, the thing is that you can't stop. We've talked about this where, you got to do your own homework. You've got to do some work on your own, unless you're going to see Eric, 7 days a week. I've got a little program now that I can go home on and, 8 to 10 minutes a day, along with some percussion therapy that I've been doing, to get some mobility back in my shoulder. And I think it's been a big help, and it was good to get that assessment.
Maybe I should have done a better job, Steve.
No, you did a great job. And I can sleep now on my right side, which was great. But, I know, and Eric and I have talked about this, Dr. Cohen. You tell me, surgery is surgery, right? You've seen it with some of your patients trying to come back from these things. It's not easy, and it takes a few years, correct?
It can, yeah, and there's certain joints that are more prone to scar tissue, and then you get abnormal movement patterns, especially, when you think about golf. It's not just the shoulder, it's your torso, it's your elbow, your wrist, your lower, it's your core. It's kind of everything. So I can see how these, functional movement screens would be really relevant to a sport like golf as much as anything else. But yeah, the problem with shoulder surgery is that we post-operatively see issues pertaining to loss of motion and scar tissue. So it all kind of feeds together. That's why rehab and recovery is so important after these operations.
And Eric, I want you to pick it up from there. Some of the things that you've seen, obviously, with my own situation, but people similar to me following surgery and their limitations, and what do you do for them? That's what our listeners want to know.
Sure. So a lot of the times, like I said, we go through the assessment process that highlights where we need to focus on. And essentially what we do is use soft tissue modalities, whether that's soft tissue work such as massage therapy or Graston therapy, which is a form of breaking up scar tissue. We essentially allow the tissue in the joint to move a little bit more, get a little bit more extensibility. That way we can start to reprogram the way that you move. We can reteach you to move into and out of positions and create strength and stability at these end ranges of motion. And over time, developing these patterns puts you in a better position to be able to, for instance, swing a club or do general movements, whether it's sprinting or deadlifting or whatever it is. But if we can get you to get there comfortably without any external force, no weights in your hands or anything like that to force the movement, but get you to develop this pattern of moving into and out of position with good form and with good stability, it translates over to sport and general human movement really well, and people are far more resilient, and they can do the things they like to do for significantly longer because of it.
Plus, I imagine to prevent injury, right? Is this what it's about for
absolutely
as well?
Yeah, absolutely. So the end range stuff, the end range of motion stuff is really a key point here because if you never get into an out of position, Steve, you and I talked about this, the other day where we talked about, like a bell curve, right? Where your body will eliminate some of those end ranges of motion, their ability to produce force at those end ranges. So if you're put in a compromised position, say it's a slip or, some sort of weird force going through the body, because of any sort of external force, if you have more usable range of motion, you are better adapted to absorb that force and let it kind of transfer through you and save the tissue and save the bone structures and save some of the connective tissue in the area versus clinching and then the external force kind of overcoming that tissue and causing a tear or some sort of pull into those tissues. So injury prevention is huge. Plus, it allows you just to, like I said, move a little bit more efficiently. So, you're training muscles the right way. You're not compromising form just to move weight, if that makes sense.
Absolutely. Eric Ridings again with Mobility Works Chicago. Dr. Cohen, you had an assessment. Did you notice any deficiencies or any shown to prove that you had some deficiencies in some of your things when you're thinking about rock climbing or some of your favorite sports?
I did, Steve. Some of it was flexibility and range of motion, and some of it was really core weakness, depending on what was being measured. So there's no question, and it was really helpful actually to gauge my progress over time.
Well, great. Okay. Well, Eric, almost out of time. Let us know how people can reach you. You're right off of Superior and Orleans in Chicago. Easy access. And again, you're at Mobility Works Chicago. What's the best way people can seek more of your advice?
Sure. Yeah, so we're located at 314 West Superior, just off the highway. And you can reach me. You can go to mobilityworkschicago.com, or you can email me directly at eric@mobilityworkschicago.com. And for any of the listeners, I love to talk this stuff. I love to give it, help out with any advice. So please feel free to reach out. And I'd love to help out anybody who's in need. So thank you guys so much for having me. I really appreciate being on. This has been great.
Thank you.
Absolutely, Eric. And again, for golfers, Titleist has a great program, the Titleist Performance Institute, and Eric is a full certified professional in that range. So if you're a golfer and trying to get a little more limber and help with your swing, he's not going to work on your golf swing, but he will work on your body to allow you to work with your golf professional a little easier. So we appreciate it, Eric. And we're going to take a break right now on Sports Medicine Weekly. When we return, it's our staple of the show. It's our Ask the Doctor segment. Got a great one for Dr. Cole. We'll share that with you when we come back. You're listening to Sports Medicine Weekly, only on
670 The Score.